My name is Dr. Barrie Tan. I'm a ear, nose and throat surgeon practicing in Gleneagles Hospital. I have my own private practice and I've been practicing ENT or ear, nose and throat surgery for over 10 years. Ear, nose and throat surgery actually is a very wide sort of medical practice, and we see medical conditions affecting, as the name implies, the ears, the nose, as well as the throat. We handle three of the main senses that we have. We handle the sense of hearing, the sense of smell, and the sense of taste. I think patients will be rightfully concerned and should seek specialist opinions when there is the potential for an urgent medical condition to be addressed. And these usually would present with certain symptoms such as sudden onset of pain, swelling, as well as bleeding. These are the three most common sudden onset symptoms which should alarm a patient, and we should bring him or her into the clinic. However, patients shouldn't disregard deterioration in terms of their function of their various organs. Say, for example, the most common loss of function in the ears, which is the loss of hearing. It can progress slowly. So I would say that it is important, once you notice that something is amiss with regards to the basic function of your ears, nose or throat, that you should seek out that treatment, not just to exclude the possibility of a tumor or an infection, something that can be treated quickly, but it will lead to a much better quality of life, and therefore an investment in terms of living out your life well. Yes, I had the privilege recently of caring for a pair of twins from Philippines, and they presented with delayed speech and language development, and parents subsequently discovered that the reason why the two boys, and they're identical twins, were not speaking well was because they couldn't hear. And in fact, their degree of hearing loss was in the severe range, and unfortunately hearing aids was not sufficient to benefit their hearing so that they could pick up sufficient speech and language. So we elected to perform an advanced type of hearing implant surgery. It's called the cochlear implants. Cochlear implants is what we call a semi-implantable hearing solution. And basically, there are two components to a cochlear implant system. There is an external component, which you see here, and it's in this device, which is magnetically applied to the scalp. It contains a speech processor, it contains a microphone to collect the sound from the environment and process all that sound into specific electrical informational signals, which is then transmitted through the skin and subcutaneous tissue into the internal component. The internal component also has a magnet so that it can keep in place this external speech processor. So the two couple together by means of magnetic attraction. So that's like sticking a magnet onto your fridge. So essentially it will stay snugly and safely there. But this allows then information in terms of electrical signals and processing to pass through to the internal component, which then delivers electrical signals through a long wire and what we call an electrode, which is inserted into the inner ear. So the inner ear has the nerve endings of the hearing nerve that is ending within the sensory organ called the cochlea. And in most types of sensory neural hearing loss of the type which this set of twins have, the main pathology or the problem happens to be in the function of the cochlea. And the function of the cochlea is simply to convert vibration sound energy into electrical energy that is then activated onto the hearing nerve, and the hearing nerve passes on the electrical signals to the brain. So when the electrical signals now are inserted into the cochlea, it bypasses the function of the cochlea entirely, and it directly stimulates the nerve endings which are located within the cochlea, and it then transmits the electrical signals directly through a working hearing nerve. Previously, patients used to wear very large behind the ear speech processors. In fact, you even needed some of the older versions which had a little like a pocket device which acted like that speech processor. But everything is now, with the benefit of an evolution in terms of materials as well as sound processing technology, been miniaturized such that you can see everything is just held within a very thin external speech processor. The internal device that is implanted does not need to be changed. Once implanted, it can last the child for life, and so it's meant to last the child for the full 80-90 years of his life that is to come. So that's one type of hearing implant technology which I do, and the success of it has been tremendous. It allows deaf children who are born deaf to speak and talk just like you and I. I feel that Gleneagles Hospital, which is the hospital that I practice in, has invested heavily in terms of the latest state-of-the-art equipment to enable us to offer these to our patients. Minimally invasive surgeries such as endoscopic ear surgeries that we talked about just recently is possible because Gleneagles Hospital in Singapore has the necessary equipment, and these are specialized equipments which afford us the ability to perform and offer this to our patients. Prior to my joining private practice, that investment was not yet evident, but because I brought that surgical expertise with me into my practice in Gleneagles Hospital, Gleneagles Hospital has supported me and invested with the necessary endoscopes as well as microsurgical instruments which are specially designed for endoscopic ear surgery in order to support the work that I do. So from the investment point of view of state-of-the-art equipment, Gleneagles Hospital is an ideal choice, and also the surgeon expertise is available because now we've been able to offer that recently. Thank you.